Welcome to Launchpad Live, Spokane's Business Connection Show. I'm Monique Cotton.
And I'm Bill Kalivas. Today we are coming to you from the WSU Spokane campus, specifically the nursing school. And as you'll see throughout the show, there are some exciting things and exciting changes happening on campus.
We're here today to talk about the future of health sciences in Spokane, why $78.6 million is a magic number, and the reasons Spokane's health science academics are unique.
That's right, and we'll talk about that and much more. Launchpad Live starts right now.
Joining us for our special guest segment from WSU, Dr. Brian Pitcher, he's the Chancellor, Dr. Patricia Butterfield, she's the Dean of the College of Nursing, and Dr. Ken Roberts. He is the director of the WWAMI program in basic medical education. Thank you so much for coming. I hope I got all that right. It's a mouthful. That's some important roles here in this room.
Let's get right to the heart of the matter. So can you tell us about the Academic Health Science Center? What is it, and why is it so important to Spokane? Dr. Roberts, can we start with you?
Well, a Health Science Center is a collection of colleges or schools that train healthcare professionals, and so it's a collection of things like a school of nursing, like a school of pharmacy, like a medical school or a public health school. Even a veterinary school can be part of an academic health center. And the idea is when you have all these professions training together, that when you put them together you get something that's better than the sum of the parts, if you will.
Sure.
So it's a great place to come and train because you're interacting with all kinds of healthcare professionals and faculty who teach healthcare professionals.
So obviously other communities have medical schools. What makes Spokane so unique?
Well, I think our uniqueness comes from our newness, and in some cases our smallness. Most medical centers, academic health centers, have large established medical schools, for instance, and usually those schools have been there for a long time and operated independently, and so they don't interact very well, even though they call themselves an academic health center. Here we think because we're just starting and we're very much communicating with each other, that we can start something that's much more interprofessional in nature and much more interactive and make it a much more rich environment for our students to train in.
May I just add that the newness gives us opportunity to develop this set of professional relationships in research and clinical services also for this century. The practice, the research, the delivery of healthcare has changed significantly, the problems we address, and so we can plan and start fresh for the world today.
So Dr. Butterfield, help us to understand why this is important. Why is it important to focus on health sciences? Why should we care?
What's important is that when you look at the needs of people, whether they're patients or people in the community, most of the problems they face in terms of health and healthcare really have to do with the needs and what can be offered by several professionals at once. So if you look at a problem like diabetes or cardiovascular disease or motor vehicle accidents or environmental exposures, if we're going to have the creative ideas to address and come up with the solutions that really get to the core of understanding these, we need an interprofessional team in a different way. Hence, we would build a different type of academic health science center in 2012 than most places which built their academic health science center in between 1910 and 1950. So we're here to capitalize on the way of addressing the complex problems that people face today.
Right. Well, a lot has changed since 1910 or 1950.
Absolutely.
So we really need to move forward, especially with medical and health sciences.
Absolutely.
Right, and we all know that Spokane relies on healthcare delivery and the healthcare workforce, obviously. Doesn't it encompass about 20% of the workforce, I'm told? So how will the center really affect the local healthcare workforce in general?
Well, in many important ways, the workforce development certainly is there an important piece of it, that we train the future healthcare workforce, the doctors, the dentists, the nurses, the pharmacists. But secondly, we will create a research enterprise which will help to stimulate development of new intellectual capital, commercialization, the partnerships, the opportunity for the expert clinicians to work on an academic health science center provides opportunity for their professional development to recruit and retain really world-class clinician researchers, and that's what we aspire to recruit and keep.
You've talked a little bit about research, so tell us more about that. Give us some more details. What will be researched at the Research Center?
Well, a number of things. I mean, research is really the heart and soul of an academic health center, and really drives innovation, drives changes in healthcare, discoveries and deliveries, many of the things Brian and Patricia were just saying. We have several areas of strength already. In our particular division in WWAMI, we have a very strong center in sleep neurosciences that spans everything from sleep and performance, which is studying humans and how the lack of sleep, not usually the excess of sleep, but usually the lack of sleep affects their behavior. And then we have a cohort of basic scientists who on the teaching side, they teach our students, in the basic cellular molecular biology types of things, but in their research, they're looking at the actual neurobiology of sleep and how important it is for the function of the brain and as a result, the function of the human.
Well, if you need a guinea pig, I think I know where I can find one.
Yeah, she's wanted to put me to sleep several times. Let me tell you.
I don't know that I'm the only one.
Let me say a little bit about practical applied research. One of the things that I think Dr. Roberts is doing across the campus is really building a cadre of excellence in terms of clinical science and basic science. The other aspect that we're looking at when we look at nursing research or pharmacy research or different aspects of applied research is that we're looking at clinicians at the bedside looking at practical solutions. If you look at Dr. Cindy Corbett's work looking at medication errors, she looks at when people are dismissed from the hospital and they go home and they get out their pill bottles and they try and figure out, when do I start taking my blood pressure pill again? We know that there's a lot of concerns about people being confused, and oftentimes that results in a rehospitalization and sometimes a fatality. So when we engage clinicians really at the bedside, working with basic scientists, the excellent scientists in sleep, behavioral disorders, mental health problems, substance abuse, environmental health problems, when they look at that together, the magic that happens between someone who's working in the laboratory and somebody that's working at the bedside, that's when the new ideas come. And the
connection.
Absolutely. And I think what Ken has said about being silo-free, we haven't built those silos yet, and if we do this right, they won't happen. We'll work across curriculum. Always easier said than done, but I think we're making a lot of headway.
I sense that it's a good thing to have an academic research center in the city you're living in.
Absolutely. And we're seeing on the research side, we're seeing tons of collaboration already. Many of the things that we're talking about here involve faculty in the School of Nursing, with faculty in WWAMI, with faculty in pharmacy. And so on the research side in particular, I think we can make real headway in this interdisciplinary approach. On the education side, we're thinking the same thoughts. We want to get the students together to learn from each other.
Sure. So we hear quite a bit, I hear quite a bit that Spokane's going to have a medical school. And I've heard some people say, well, it's an academic health science center. Can you talk a little bit about the distinction and really how, and also what is WWAMI? I hear a lot of people ask, what is WWAMI? Can you talk a little bit about those three areas?
I'll start with WWAMI, how about? Yeah, so WWAMI is the medical education program that we operate under. It's the accrediting body for that is University of Washington School of Medicine, which works with Washington State University in Eastern Washington, but also works with universities in Alaska, Montana, Idaho, and Wyoming, which is the other letters in the WWAMI acronym. So we're all doing medical education through the region, and we're all doing it within this WWAMI structure, this 5-state collaboratory, if you will. At the end of the day, the students are going to receive a degree in medicine from the University of Washington, but all of the universities in the region contribute in a very collaborative and meaningful way to that education. When we talk about a medical school in Spokane, it's very real in the sense that as we look towards having a second year of medical education in Spokane, we will be in a position where a student can come as a WWAMI student and do all 4 years of their medical education in Spokane. We'll still be a WWAMI site within the greater WWAMI program. Students will still graduate with an MD from the University of Washington, but in a very real sense, we'll have a 4-year campus for medicine in Spokane.
The presence will be here.
The presence will be here.
And an important
Absolutely.
question, will students get discounts on Whammy burgers over at Dick's? Is there any
No, they're
correlation to
medical
that?
students, so that we actually tax them when we go to
Gotcha.
work.
Have you ever heard this? Wah, wah,
Yeah,
wah.
yeah. I know, right? We'll edit that part out.
Oh, okay,
Yeah.
all right, sure. So back to a serious subject. Did you want to say something else? Did you want to add something else?
Yes, you know, there are a couple of other pieces to that question as well. You know, what is the role of the medical school within the Academic Health Science Center? Well, we have some terrific anchors for the Academic Health Science Center. 4-year medical education, nursing education from baccalaureate to PhD, pharmacy education, pharmacy doctorate, PhD degrees in interdisciplinary fields. You know, the synergy of the faculty and the students working side by side in those programs is going to be tremendous for their education and for the development of science and delivery. So they all come together.
So Dr. Pitcher, what are some of the plans for the pharmacy department as far as growth?
You know, it'll be very important. Currently, the pharmacy doctorate program, students begin at the Pullman campus, take their first 2 years there, and then relocate to Spokane for the 3rd and 4th year experiences, which are clinically intensive. Beginning sometime 2013, fall 2014, all 4 years of the program will be offered here, and the students will have their full experience here on this campus. That provides opportunity that pharmacy will add basic scientists to this campus as well as their clinicians. They will add, 215 additional students, totaling probably over 500 pharmacy students to go with. How many nursing students now do we have?
1,000 nursing
1,000?
students.
Isn't that
system-wide.
significant?
Wow,
An
very.
aspiration to have 400 to 500 medical students at some
Absolutely.
point. You know, that's a very significant enterprise, and it'll make a tremendous difference in the workforce development for our neighborhoods and the neighborhood development, for the success of our clinics and access of health care for all of the region.
That's great. Dr. Butterfield, quick question. So the nursing school has a new emphasis on advanced degrees. Can you talk a little bit about some of those programs?
We educate, about half of our students receive bachelor's degrees, and then we have a large group that become a master's student in either as a family nurse practitioner or a psychiatric nurse practitioner. The last group of master's students we educate receives a degree in what we call population health, so it's a focus on epidemiology and understanding systems health. Then the final program that we offer, and that program began under the leadership of Dr. Ruth Bindler in 2007, was to educate PhD nurse scientists. And if you look at the 2.9 million nurses in the United States, the greatest gap in the nursing workforce is for nurses that have PhDs, that are educators and scientists. Dr. Barb Richards in this room is one of the graduates of the PhD program. Those are nurses that know how to work at the bedside and design a study addressing patient falls or sexually transmitted diseases or cardiovascular health or a variety of conditions, and then really looking at designing the study and coming up with practical answers that create the body of evidence that we need to provide safe care.
So is it your assessment that nurses will require those advanced degrees in the future? Will that become more common?
I think that nurses require those degrees now. If you look at nurse practitioners, which in this state have full prescriptive authority, they have a bachelor's degree and then 2 to 3 years for either a master's degree or a clinical doctorate. In many communities in Washington state, if you go up in the Okanagan or down in the Central Valley, there are many communities where a nurse practitioner or a physician assistant is the main person providing primary care, whether it's in an urgent care clinic or in a skilled nursing facility or in a public health system. And so working with physicians and really working in partnership with the rest of the system, I think they're a really important gap, address an important gap in healthcare, and they need an advanced degree.
If you don't mind, I think we should also just point out that there are shortages in all of these healthcare fields, and these graduate level nurses, nurse practitioners are in very high demand, as are primary care physicians. That the current workforce studies indicate that we're short today and are going to be increasingly short in 5 or 10 years from now. Mm-hmm. It's going to be more and more difficult for the rural areas, even for Eastern Washington, North Idaho, to recruit and retain. So we need to produce our own.
Is that true for physicians as well? The shortages that they talk about?
Yeah, just as true for physicians, maybe even more so in terms of physicians that would practice outside of the metro areas in the smaller towns. And
in the rural communities.
in the rural communities. And that's always been a primary focus of the WWAMI program. And we think having more students training in Spokane, where we're closer to more rural areas, will actually help that. Because it's always two things.
Sure.
It's the number of physicians you train, or any healthcare profession, and then it's also the number of those that you can get out into the areas that really need them the most. And so that's very much a goal of ours.
So we've also heard that second-year medical students will begin studying here in Spokane soon. Is there anything you're doing to prepare for that?
Almost everything I'm doing right now is preparing for that.
So that's the understatement of the century, right?
Yes, I mean, it gets us back to the kind of what the WWAMI program is, and just returning to that, so because most people don't really understand, if you're a WWAMI student coming to the program, you will do your first year someplace. It could be Spokane, it could be Pullman if you're a Washington student, or obviously the majority of them go to Seattle. If you're from one of the states, you'll do your first year in those states. But a key feature of the WWAMI program for all of its 40-year history has been all the second-year students go to Seattle, and they spend their second year together in Seattle. So now 100 students start in Seattle, and another 120 start in the region, as we call it. 220 are in Seattle for year 2. That creates an obvious bottleneck. The WWAMI program needs to be 2 or 3 times as big as it is, just to be average in size for the population we serve. And there's no way a second year can be that big in Seattle. And so there's a real impetus to begin to learn how to deliver that second year, which is a very important year in the education process, someplace besides Seattle. And so Spokane is going to be that first site. And we're very excited about that, but there's a lot to do, a lot of faculty to get developed, and a lot of curriculum to develop, and that sort of thing. But we're planning to start it a year from this fall, so fall of 2013.
We'll be on the lookout for that.
And that, by the way, is the last year that's not taught here, so that completes a 4-year experience.
Great. So, Dr. Pitcher, can you describe the community support that these programs have received, and really what else needs to be done? But we've talked about this before. I mean, the community has really rallied around this great vision for the healthcare, for Spokane being a healthcare center globally, and being known for some of these great programs. Can you talk about the community support so far, and maybe what else is needed?
Well, I agree with everything you've said.
Which is a first.
Right, that never happens.
No, you and I have agreed once or twice.
Right.
Very rare.
We like to point out that the community was really behind the identification and setting aside of this property for development of health sciences and university. And can you imagine 40 years ago the vision that they had to begin that process? I've seen studies going back to the 1960s in terms of aspirations to build medical school, and these programs. The momentum really increased in the last 6, 7, 8 years. With the realization that we could really do this, and the business community, the healthcare enterprise came together. So we go to the Olympia together, we go to Washington D.C. together with the same agenda. We work together every month on how do we build each piece of this. The community support in the partnership is really very unique, and will be the force that really carries this through. Tremendous momentum.
What else can be done? I mean, we've got some very innovative and creative thinkers in this community, And a lot of the heavy lifting has been done already to get it started, but what else can the community do to rally support?
Oh, a lot. We're just beginning. The building is very symbolic and it's kind of the tipping point, but we have to fully occupy that building, which means equipment, which means hiring highly competitive research scientists. I think each of these colleges is looking at those hires, but now they're getting interest of a faculty who are asking the question, well, I could really develop my careers here. And so the community can help us with private funding for professorships, to support of graduate students, to help with the commercialization side of it, because we're going to have to build all of those connections in a very competitive way. So this continues.
So on that same note, here's a big umbrella question. Fast forward 15 or 20 years. What does the River Point campus look like? Any one of you or all of you can answer.
I see us being a place of discovery where other academic health science universities can't go. They don't have the skill set. They were never built this way. And so I see us really creating the discoveries and the in-between issues. I see us being a very green place. There are a lot of higher education institutions that are looking at being more sustainable. There's a lot in healthcare. Healthcare is 8% of the carbon footprint for the United States, but I think there's an opportunity to be a greener place here. I think that we can look at unique behavioral challenges in terms of people that are struggling with prescription opiate use, with substance abuse. And then I think the exciting thing is I think we can be doing things, addressing issues that we haven't even put on the plate yet, because this is going to be where people want to come to do that. And it's going to draw that excitement. And already through the work of Chancellor Pitcher, Dr. Roberts and others, I think people are saying this is the place where there's a lot of unfreezing happening, and this is the place that if you want to make your mark in terms of a new area of reaching out to help people, Spokane and WSU can allow that door to open.
So really, in a nutshell, Spokane is going to be kind of a healthcare hotspot.
Absolutely.
Yeah.
Yeah,
I like the sound of that.
Yeah, that's brilliant. I think the passion comes through as well in the three of you, and then everyone that I talk to that's affiliated with this program has an excitement and an energy level and a passion that you demonstrated today. So we appreciate it.
There's no question. The community is excited, we're enthused, and we know this will work. We know we'll be successful because of the leadership that's being attracted to this. I also wanted just to emphasize that in this vision, what is also unique is that it's multiple universities working together. We're not only breaking the silos of college and profession to profession, but people really shake their heads when they learn that the University of Washington and WSU are partnering on a degree program in medicine, that we're teaching the significant part of the curriculum, and they are teaching a significant part, and it'll be their degree. We support the physician assistant program on this campus. Eastern Washington University's occupational physical therapy, their partnership in dentistry. It is very unusual at multiple universities. And we're even getting to the point where they're talking about moving to the semester system to join us, you know.
I heard that today.
Yeah, so we will be tied together more closely. So this is one of the few places in the country where truly universities will work in an integrated way rather than siloed building next to building.